Question 67. A 30-year-old male with a history of unexplained abnormal liver function tests undergoes a bedside liver biopsy. Shortly after, he collapses and is found with a pulse rate of 120 bpm, unrecordable blood pressure, and a distended abdomen. Considering the situation, when would be the most suitable timeframe for performing an exploratory laparotomy? Option A, within 1 week. Option B, within 4 hours. Option C, immediately. Option D, next day. Considering the critical condition of the patient, most appropriate would be option C, immediately. Explanation. The patient's symptoms, including a rapid pulse rate, unrecordable blood pressure, and a distended abdomen, indicate a potentially life-threatening situation such as internal bleeding or hemorrhage following the liver biopsy. Immediate surgical intervention, exploratory laparotomy, is essential to identify and address the source of bleeding or other complications. Delays in surgical intervention could lead to worsening of the patient's condition and increased morbidity or mortality. Question 68. In a case involving a 75-year-old man undergoing a physical examination, a firm solitary nodule is detected in the prostate during a digital rectal examination. Subsequent biopsy reveals small, closely packed glands containing cells with prominent nucleoli. What is the most likely diagnosis? Option A, urothelial carcinoma. Option B, adenocarcinoma. Option C, chronic prostatitis. Option D, prostatic hyperplasia. The most likely diagnosis based on the described findings is adenocarcinoma. Explanation. The presence of a firm solitary nodule in the prostate, along with the histological features of small closely packed glands and prominent nucleoli, is indicative of prostate adenocarcinoma. Adenocarcinoma is the most common type of prostate cancer and often presents with similar characteristics on biopsy. Question 69. A 15-year-old boy presents with a 2-day history of fever, nasal discharge, malaise, fatigue, and myalgia. His temperature is 38.8 degrees Celsius, and his blood pressure is 122 by 74 millimeters of mercury. Incidentally, urine dipstick testing shows 2+ proteinuria but no hematuria, pyuria, or active urine sediment. His serum creatinine level is within normal limits. What is the most appropriate next step in managing this case? Option A, repeat dipstick testing on 2 subsequent occasions. Option B, order a 24-hour urinary collection for protein. Option C, reassure, with no further workup. The most appropriate next step in managing this case is repeat dipstick testing on 2 subsequent occasions. Explanation. Isolated proteinuria on urine dipstick can have various causes, and it's important to confirm the presence of proteinuria on repeated testing to rule out transient or benign causes. 2 subsequent occasions of positive proteinuria would provide more reliable information about the persistence of proteinuria. This step helps to differentiate between transient proteinuria and potential underlying kidney issues. Question 70. In the case of a woman with a history of recurrent miscarriages, a positive lupus anticoagulant, and antiphospholipid antibodies, the appropriate treatment option to prevent venous thrombosis would be Option A, warfarin long life. Option B, heparin. Option C, enoxaparin long life. Option D, rivaroxaban. The appropriate treatment option would be Option C, long-term enoxaparin therapy. Low molecular weight heparin, similar to standard heparin, suitable for long-term prevention of blood clots in individuals with a history of recurrent miscarriages and antiphospholipid antibodies. Warfarin's long life is not ideal due to potential interactions and birth defect risk during pregnancy. Heparin is the preferred injectable anticoagulant for long-term use in preventing venous thrombosis, especially during pregnancy. Rivaroxaban is an effective oral anticoagulant, but injectable options like heparin, enoxaparin are generally preferred due to pregnancy concerns in this case. Question 71. In a case where a patient is diagnosed with a breast mass, fibroadenoma, and histology reveals lobar in situ carcinoma, what would be the appropriate course of management? Option A, chemotherapy. Option B, radiotherapy. Option C, mastectomy. Option D, vigilant high-risk follow-up. Given this risk, mastectomy is often considered the appropriate management option. In this scenario, the presence of lobar in situ carcinoma, even though it's considered non-invasive cancer, indicates an increased risk of potential progression to invasive breast cancer. While options like chemotherapy and radiotherapy are commonly used for invasive breast cancer, they are not typically the first-line treatments for non-invasive carcinoma. High-risk follow-up is important. But the presence of lobar in situ carcinoma indicates a higher risk that may not be adequately managed by follow-up alone. Question 72. A man presents with weakness on the left side of his body. Upon clinical assessment, he displays facial nerve paralysis and hemiplegia. What should be the initial step in his management? Option A, aspirin. Option B, clopidogrel. Option C, head CT scan. Option D, head MRI. The initial step in the management would be a head CT scan. Explanation. Given the sudden onset of neurological symptoms, the first priority is to rule out any acute intracranial issues, such as a stroke or bleeding. A head CT scan is often the initial imaging modality of choice in such cases because it can quickly detect significant abnormalities like bleeding, tumors, or large infarcts. Aspirin and clopidogrel are antiplatelet medications that are typically used to prevent blood clot formation. But they are not the immediate first step in the diagnostic process. They might be considered after the cause of the symptoms has been identified and managed. MRI of the head is a more detailed imaging modality, but it takes longer than a CT scan, which is faster and can provide a quick assessment of whether urgent intervention is needed. Question 73. A 38-year-old female visits the clinic after a chest X-ray revealed hilar lymphadenopathy. She experiences occasional coughing but denies fever, headache, nausea, vomiting, and weight loss. Lab results are mostly unremarkable, except for hypercalcemia. A CT-guided biopsy indicates non-seeding granulomas. What is the most appropriate next course of action in management? Option A, monitor the situation without intervention. Option B, initiate prednisolone, glucocorticoids. Option C, commence azithromycin treatment. Option D, begin anti-TB medication. The clinical presentation of bilateral hilar lymphadenopathy along with non-seeding granulomas and hypercalcemia is suggestive of sarcoidosis. Sarcoidosis is a systemic inflammatory disorder characterized by the formation of granulomas in various organs, most commonly the lungs and lymph nodes. In cases of symptomatic sarcoidosis with organ involvement and hypercalcemia, glucocorticoids, such as prednisolone, are often used as the initial treatment to reduce inflammation and control the immune response. So correct answer is option B.